In this video, I will answer a question on what causes tightness and pain in the area directly between the shoulder blades in the mid-back. Expect to learn the following. 2 common causes of mid-back pain tightness that most providers completely miss. Why does stretching, getting a massage, or an adjustment only produce temporary relief? How to get long-lasting mid-back pain and tightness relief, and strategies to help keep the pain and tightness from coming back. For those of you who don't know me, my name is Dr. Matt Maggio. I am a soft tissue injury treatment expert. My focus is on diagnosing and treating adhesion, also known as scar tissue, and reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which leads to a significant increase in overall functioning, flexibility, and long-lasting pain relief. This week's question came from Nikki on LinkedIn. Let me read it. It says, why does the middle of my spine always feel like a brick wall and make it seem impossible to be able to hold my head up straight as the day goes on? I stretch and do yoga all the time. Go once a month to the chiropractor and get a deep tissue massage afterwards, all of which lasts for a few days, but it all comes back. Thanks for sending that question in, Nikki. And just a reminder to everyone else out there, if you're dealing with a chronic injury and pain, and you're struggling to get some real answers as to what's going on, you can submit your questions directly to me. And if my insights can help, I'll be sure to get a video out to you. So 2 common causes of mid-back pain tightness that most providers completely miss. The first one is this ligament called the supraspinous ligament. I'm going to show it here. You can see it next to me here. And basically, the job of the ligament is to stretch and provide stability to the area. And a lot of times when there's an issue in there, it's really tight, it's really sore, it's really achy, it's very restricted. It just feels like it's a brick wall and doesn't move. And basically what happens over time, with a sedentary posture, we spend a lot of time on devices, looking down at our phones, all sorts of things. That ligament just gets stretched out. And when it gets stretched out, it doesn't get enough blood flow, doesn't get enough oxygen. It starts to develop this stuff called adhesion. It's like also known as scar tissue. It's like a glue that gets inside there and makes the ligament less flexible and weaker. So what happens now is the muscles around there, they have to start working harder and harder. And when they do, they get overworked too. And then they start to develop some adhesion as well. And then that adhesion starts to get bigger and bigger. Then what happens is eventually you get these nerves stuck. And the most common nerve to get caught right in that area, like right between the rhomboids and right between the shoulder blades, is a nerve called the dorsal scapular nerve. It's really important in functioning of that area. And when nerves get caught, they present with things like numbness, aching, burning, tension, because it's trying to protect that area. So what's happening is it starts in the ligament, then eventually it goes to the muscle, then the muscle gets caught to the nerve. Now, nerves are built with about 10 or 15% of extra slack to keep them healthy. As that scar tissue and adhesion builds up, it eventually gets glued there and creates that entrapment. A lot of people think stretching, getting a massage, or an adjustment will help, but it's only producing temporary pain relief, if that at all. So I brought out this rubber band. So basically when the adhesion gets in there, it just makes it harder for it to be able to stretch and contract how it's supposed to. Now, when you do some stretching, what it does is it does pull on that a little bit, and it stimulates these receptors inside the muscles, and they temporarily relax, and you get this window of opportunity where it feels better. But there was no actual change to the adhesion or freeing up that nerve entrapment in that area, which is why it temporarily feels better. It's like the same thing when you get an adjustment or you get a massage. They're going in there and they're stimulating some stuff. The best example I can give is like when you jam your thumb in a car door, the first thing you do is you start to move it around. What that does is kind of plays a trick on your brain and your spinal cord and blocks that pain temporarily. That's what stretching does. That's what massage does. That's what an adjustment does. It temporarily reduces that, but it's not getting to the root cause of what's going on, which is that adhesion buildup in the ligament, in the muscles, and around the nerve. So how to get long-lasting mid-back pain and tightness relief? First is we want to get in there and actually clean up that ligament and get in there and break that down. So what I want to include in the video is a demonstration of me treating that ligament and breaking it down and getting it functioning better. So I'm going to link that one up right now. And where it's really bad is right in through here. So I know that that scar tissue is there. What I'm going to do is get in there with the instrument. I'm going to back that up, go here, and I'm going to pull up in there. And I'm starting to feel for some grit. And that grit is that scar tissue. And
Each time I go through a pass, I drop the head a little bit more. You're going to see that it opens up each time. It's going to give you more access to deeper layers of the ligament, and it's going to open up even more. You're going to do about 5 to 7 passes on each area where you find that grit and get that to open up. That's going to really free up that area from what we see.
So just a couple take homes from the video. You can see it's very precise. It's very focused. Most clients describe the treatment as like a hurts but good, but nothing too bad. And that instrument just does a really good job of breaking down all that adhesion in the ligament, because it's hard to treat with the hands directly. It's right up against the bone, but it's such a critical structure to get treated to really restore function, movement, and flexibility back to that area. Then the next one we need to do is we need to go in there and actually break down that dorsal scapular nerve. Now, nerve entrapments are really important. They're a really big deal, and so many providers completely miss them. They think when someone has like a knot or a trigger point that it's just in the muscle. That's that nerve getting caught. In order to break the nerve down, we need precise depth and precise tension. And then we have the client go through a full range of motion. So we say if we have this rubber band and we need to break it, we could put it on the ground. I could jump on it. I could drive it over with a car. I could stomp on it. It's not going to break. What breaks it down is getting tension on that. So what we specialize in our clinics and our treatments is getting precise and focused treatment on that nerve entrapment and breaking it down. When you free up that nerve entrapment, it allows everything else around there to relax and not contract so much, because when the nerve is caught, everything tightens up in a protective way, and you can do all the stretching, all the adjustments, roll on it with a lacrosse ball. You're not actually removing the problem. It needs precision and the right type of treatment with someone that specializes in adhesion treatment, which we demonstrated in these videos. So just a couple strategies to help the pain and tightness from coming back. First is just get the adhesion treated by a soft tissue treatment specialist. That's where you have to start. I always say, think of the adhesion as like a cavity in the teeth that needs precision and focus. A lot of that other stuff is like brushing and flossing. It's not going to fix it. It's past that point. So get to an adhesion treatment specialist first and get that area functioning better. Next is just watch yourself on your devices and your electronics. A rule that I have is I call it the 4-finger rule. And basically, we want to have 4 fingers between our chin and our chest when we're looking at a device. They want to be 4 spread out fingers, not 4 here. So if you find yourself looking down too much, do that. And a big thing that I always teach is don't bring your eyes to the device, bring your device to your eyes and bring it up like that. That's going to keep things neutral, not put you in those bad positions. So if you got the adhesion cleaned up, then you go right back to all that stuff all over again. You're going to be right back to square one. And lastly, once you get the adhesion cleaned up, you're watching the load, you're watching your posture, you do need to build up the muscles in the mid-back, specifically in the erectors in the mid part of the thoracic spine. There's 2 ways to do that. One is an exercise where you're laying face down. You do this exercise called a prone extension. And another one that I found that works really well is doing what's called rucking. So rucking is where you put on like a backpack and it has some weight on the back part there. What that does is it really just forces your posture and that strength to build up in there. It's been great for all my clients. I've seen it with myself. It's really helped to just build some strength in that area after we got all the adhesion cleaned up. So that's all I got for you in the video. If you're dealing with a chronic mid-back tension and pain between the shoulder blades for, I'd say, at least 6 months, you've seen way too many providers, you're still having issues, then reach out direct to us and set up an injury consultation to get some real answers as to what's going on and get on the path to long-lasting pain relief so you can stay away from pain pills, injections, and surgeries and wasting your time on never-ending adjustments, stretching, massage that never gets to the root cause of what's going on, and then things just get worse. All the information to request that consultation is included in our profile or wherever you're consuming this video. I appreciate you watching, and we'll see you on the next one.